When we talk about preventive health care, we talk about holistic health. We don't talk about just absence of disease. Health check is not just a set of reports, whether blood reports or radiological reports. So when we talk about health, there is a primary prevention, there is a secondary prevention. Most of the things we cannot change. We cannot change the lifestyle, we cannot change the work, we cannot change the environment. What we can change is our reaction. Namaskar, I am Dr. Bela Sharma. I am heading the Department of Preventive Healthcare and Lifestyle Medicine in Fortis Memorial Research Institute, Gurgaon, India. Our department is called Health for You. Let's talk about preventive healthcare. What is preventive healthcare? The idea of preventive healthcare is not new. When we go out in winters, we cover ourselves nicely with warm clothes so that we don't catch cold. During summers, we try to drink more water, keep ourselves hydrated so that we don't get dehydrated or we don't have sunstroke. During rains, we wear raincoat or carry a umbrella so that we don't get wet and we don't catch illnesses that way. Even vaccinations. We give vaccinations to our small children so that they don't get infections and they don't get ill. During COVID, we all saw wearing masks. Again, that was preventive healthcare. Why? So that we don't catch that infection. We are preventing ourselves. What has changed in past, say, 30-40 years, I would say, or maybe even more? The diseases that were happening earlier, the disease profile has changed. Earlier, we were preventing ourselves and our families from infectious diseases. However, in past few decades, with the advent of better antibiotics, better health measures, better lifestyle, infections have more or less been controlled. However, with more industrialization, globalization, urbanization, lifestyle has changed. Some things have become better, but a lot of things have become slightly, I would say, worse. One of them being the health priority. Earlier, we used to see people above the age of 40 or maybe 45 were suffering with diabetes or high blood pressure. Now, the disease pattern has changed, whereas infections have decreased, but lifestyle disorders have increased. So, what happens is most of these disorders are asymptomatic, which means unless we check, we do not have any idea that we have this problem. Diabetes and high blood pressure are known as silent killers. Either a person goes for a checkup and gets to know, or they present in the hospital as a catastrophe. Heart attack or a stroke or maybe something even worse. What is the answer? Preventive health care. This is why we should undergo preventive health care. Now I will say who should undergo preventive health care. Everyone. Preventive health care is for all of us from the age of 18 to 80 and maybe even more. Because with increasing lifespan, the number of disorders is also increasing. Not only that, morbidity is increasing because most of these lifestyle disorders, the complications are what are more dangerous. See, if a person has diabetes, there are no symptoms. There is no problem. But what we are concerned about is the complications that are going to happen in the organs, and they increase with age. It is the number of years that a person has had diabetes that matters. So when age increases, lifespan increases, life expectancy increases, the complications will also increase. So elderly need to have regular health checkups. For younger population, again, like I said, earlier we were seeing people in their third, fourth decade with these illnesses, but now younger people in their 20s, in their early 30s are coming with diabetes, with their high blood pressure, even with heart attacks. So to prevent all these, what do we need? We need to have regular health checkups. So that is why I said everyone needs to have proper and regular health checkups. Now these health checkups include not only blood tests and radiography tests, they also include a discussion with your physician. See, getting a blood test done nowadays is not difficult. Everything is available online. You give a call to a lab, they will come take your blood sample and the reports will be there on your phone. You can check online, what does this value mean? What does this value mean? But you need to have someone who will explain. See, you need to correlate. That is why you need to have a proper health checkup with a person, with a physician who will tell you what are the advantages, what are the disadvantages, how to correlate one test with another, and how to correlate that with your symptoms, with your age, with your personality, with your lifestyle. Because ultimately, it is a human being that we are dealing with. We are not dealing with a set of papers. We are not dealing with a report. That is why health check is not just a set of reports, whether blood reports or radiological reports. When ideally every year, once a year, if there is any discrepancy in the reports, then I always tell that yes, I'm writing down these measures you need to take and review maybe after 3 months or 6 months or whichever time. Even if you're not able to come to me, then wherever you are, wherever it is convenient to you, please go and get yourself checked. This is again very important. There are some places where people go for a health check maybe after 2 years, whichever way is convenient. But certain things we need to get done regularly, especially if a person already has a lifestyle disorder like diabetes or high blood pressure or some other problems. So these are the things that need to be done very, very regularly. We are not only talking about prevention of a condition, we are also talking about prevention of complications related to that condition. So when we talk about health, there is a primary prevention, there is a secondary prevention. Supposing a person comes to me and I find out that they already have either any of the lifestyle disorders. So the damage that has already taken place, there's nothing I can do about it. Body can heal, but if the damage has taken place, it's like you tear a paper. Even if I join it with the glue, the scar will always be there. But what I can do is I can prevent from tearing it further. So that is exactly what secondary prevention is. What we can do is we can prevent further damage from happening. So with all facilities available to us, with all technology, with all knowledge that we have, it is not right that we still have people suffering from lifestyle disorders. The civilization has changed, cultures have changed. So what we need to do is we need to change ourselves. We need to change our focus from outside to inside. And how does that happen? We start looking after ourselves. And how do we do that? We do that by looking at our health. We do that by looking at our health concerns. We need to stop looking at a physician or a healthcare facility like the place where we go to if we have any problem. Because most of the times, the concern that people have, I am not feeling ill, why should I go to the doctor? Why should I go to that hospital? Prevention is better than cure. This is what we have studied from childhood onwards. That is very, very true today. What we are doing is trying to prevent diseases before it happens, and if it happens, we try to minimize it. Most of the disorders that we are suffering from today are happening because of the lifestyle, are happening because of the stress, are happening because of probably pollution around us or because of the work-related things. Most of the things we cannot change. We cannot change the lifestyle, we cannot change the work, we cannot change the environment. What we can change is our reaction to it. And what we can change is the way we look at our health and way we look at ourselves. So this is when. And where a health check should be done, like I said, go to a place where all facilities are available. Not only that, go to a place where you have good physicians, go to a place where you have persons who can talk to you, explain your problems to you, listen to you. What is more important is for you to be able to discuss and able to listen to your problems, because 90% of the times when we say this is stress related, talking about a problem relieves 50% of your stress. When we talk about preventive health care, we talk about holistic health. We don't talk about just absence of disease. We talk about physical, mental, spiritual, all kind of health. Health is a holistic process, and this is something we all need to do. And health is also one of the fundamental rights of human beings. Thank you so much. Jai Hind.